Hello friends, welcome to today's class. Although illness for any of us is an unwelcome phenomenon, yet it is an inescapable part of our human lives. And hence in this class, we are going to understand as to how we as individuals respond to illness in different ways. First, let us go over the definition of illness. Illness can be defined as a condition marked by a pronounced deviation from a normal physical state. There are some other facets of illness that we may probably know. First is that illness is a subjective phenomenon. It depends upon the individual's own personal appraisals and evaluation regarding deviations in his normal physical state. The second thing is that illness may or may not have a disease component. Now, once symptoms are perceived and evaluated as indicating some kind of illness, and once the diagnosis reveals that the individual has experienced some kind of illness or disease, the process of responding to illness starts. Now, the way in which we respond to illness can be either normal or can be either abnormal. First, we are going to see what are the normal responses to illness. Normal responses to illness may comprise two themes. The first is seeking help and the second is adopting a sick rule. Now, when we first come to know of certain symptoms in our body or certain deviations from our normal functioning, we first try to seek help. This may involve gathering information from a lot of sources, for instance, friends, family, relatives, and even the internet. Also, we may even try to seek medical help. We may go to the medical practitioner and see what our symptoms mean. Do they mean that we have some kind of disease? And if we do have some kind of disease, what are the possible implications of it? What may be the consequences of the disease? Now, there may also be another category of people who do not take any of these options. They may respond to illness in other ways by seeking other forms of therapy, for instance, relaxation or meditation or even traditional or folk therapies. Now, a second normal way in which we react to illness is by adopting a sick rule. And for all of you who thought that sickness is only about bad consequences, this is something of a change because sickness can have its privileges. Because when you are sick, the patient has some kind of privileges. For instance, he is not expected to follow his normal course and do a lot of duties, or he doesn't have any kind of responsibilities or obligations. Further, he has the freedom to make a lot of decisions, especially healthcare decisions. Also, he can demand care and assistance from others and can be dependent on them. However, no privilege comes without its own obligations or responsibilities, and the patient naturally has a lot of obligations. Now, what are these? For instance, the patient has to show the will and the motivation to get well. Secondly, he must follow very precisely all the medical procedures and regimens. He must show a maximum level of cooperation with the doctors and other health practitioners. And he must also make an appropriate use of the healthcare services provided. For instance, some people use healthcare services, for instance, pain-killing medications to a large extent, depending upon the extent of pain they have, not according to the prescriptions. So this is an inappropriate use of healthcare and must be avoided. Now, in addition to the normal responses that a person gives as a response to illness, some people may even respond abnormally to illness. Now, there are two major kinds of abnormal illness response. One is illness affirmation and the other is illness denying. Now, what is illness affirmation? People who engage in illness affirmation continue to insist that they have some kind of disorder or disease even when there are no standard medical diagnostic proofs for the same. And they may try to gain a lot of information to prove that they are suffering from some kind of disease and may even engage in taking over-the-counter medications. Illness denying is the opposite of illness affirmation. These people already have some kind of diagnosed diseases, but still they continue to deny the presence of the disease. For instance, they may refuse to take a lot of medications or follow medical practices and regimens. Also, they may engage in a lot of activities, for instance, a lot of work or exercise or play, which will further put them at the risk of aggravating the disorder they already have. For instance, a sports person who has some kind of injury may refuse to refrain from playing matches. He may want to play a lot of matches, and further, he may not even follow rehabilitation procedures. This would account to illness denying. Thus, while a normal illness response involves activities that are directed towards recovering from the illness, an abnormal illness response consists of activities that are either meant to insist on the presence of a sickness that isn't really there, or to refuse to accept a sickness that is already there. Now we are going to see how illness behavior forms a means of coping both with illness and with other aspects of life. Let us first define what is illness behavior. Illness behavior refers to the way in which symptoms are perceived, evaluated and acted upon by a person who recognizes some kind of pain, discomfort or some other sign of organic malfunction. Now, whether or not illness behavior promotes constructive coping or whether it promotes self-destructive coping will depend upon the kind of behavior the individual adopts and the nature of the disease he has. For instance, if illness behavior promotes constructive coping, the individual as a part of his behavior will engage in active coping mechanisms. He will try to gather as much information as possible about his illness. He will seek medical advice, and if he is diagnosed with some kind of illness, he will properly follow the medical regimens, the medications and the routines that are prescribed, and thus he will try his best to recover from the illness. On the other hand, illness behavior can lead to destructive coping in two forms. One is the denial or negation of the significance of the illness. In such situations, individuals believe that they do not have any sort of illness even when diagnosis says the opposite. They may not follow any kind of medical advice or regulations. Also, they may engage in a number of risky activities that tend to aggravate the disease and slow down the process of recovery. Also, they may focus on emotion-focused coping because this involves the denial of the stressor. However, although it may provide for relaxation on a short-term basis, it can have long-term consequences for both survival and well-being. Another form of destructive coping mechanism that illness behavior can initiate is the insistence on the presence of the disease even when it is not there. Now, this may either be due to the fact that the individual has some psychological disorder. For instance, people with conversion disorders, somatization disorders and hypochondriasis tend to believe that they perpetually have some kind of disease or illness, even though a number of medical evaluations reveal the opposite. And even though medical diagnosis says that they are not ill, they will try to gain a lot of information, try to find out new terms for their illness and try to report it in great detail to others. This in fact may be an unconscious response to unconscious conflicts that have been repressed since childhood, and by showing some kind of symptoms of the disease and seeking attention through the same, the individual tries to solve these unconscious conflicts. Now, what happens in these kind of psychological disorders is that the individual does not know that his disorders are in fact a psychological disease, and he may try to search for a number of underlying physiological causes for the same. For instance, feelings of shakiness, muscle aches, muscle tension, high anxiety and palpitation, which are generally characterized by generalized anxiety disorder, which is a purely psychological condition, may be misinterpreted as symptoms of a heart attack. Similarly, loss of sight, speech, hearing and sensation, which happens in certain conversion disorders, may be taken to be a nervous problem. Or the inability to understand and express emotions in words, which is a symptom of Alexithymia, may be taken to be a result of fatigue and exhaustion. And sometimes in the search for physiological causes of their symptoms, and in order to validate their illness experience, such people with psychological disorders may engage in an overuse of medication and in the use of medical strategies, procedures and even surgeries which can cause them serious debilitations. A second instance where illness behavior may lead to maladaptive coping is when the individual uses the illness behavior as a break from some kind of emotional turmoil or some kind of obligations or responsibilities he wants to escape from. Because we already discussed that when a person is ill, he is excused from a lot of daily chores. He doesn't have to take up any responsibilities and any obligations. Also, he doesn't have to failure and criticism because people rarely criticize or point fingers at a person who is already sick. Other secondary privileges include a lot of love, care and attention from those who are near to you, and you are the center of attention as long as you are sick. And people who need a lot of emotional affection and attention may pretend to be sick just to gain this, and this may not even be a conscious process. They may do this unconsciously. It must be a common observation for you that even you or those around you, in spite of having symptoms of illness, tend to postpone the seeking of medical care. And psychologists are interested in finding out as to what are the reasons for this kind of delay in seeking medical care. Now, delay can be defined as the time period between the individual's recognition of the symptoms and his actual seeking of medical care. Many times we see that people having potentially serious symptoms, for instance a lump, a chronic shortness of breath, radiating chest pain, skin discoloration and so on, tend to continue with the symptoms for weeks and months without seeking medical care. Now, what can be the possible reason for this? Psychologists underline certain major reasons. The delay in seeking medical care can in fact go over a number of stages, and delay in each of these stages amounts to the final delay that occurs in the actual seeking of medical care. The first kind of delay that we are going to deal with is appraisal delay. In this stage, the individual takes a lot of time to recognize that he or she actually has some kind of symptom that actually mean illness. If the individual takes a long time to recognize that the symptoms he has means illness, then automatically it will result to a lot of delay in medical care seeking. Or if the appraisal time is slow as compared to the urgency of the situation, for in case diseases such as heart disease and so on, then the situation can become even more complicated. Illness delay is the time between the occasion when the individual finds out that his symptoms actually mean illness to the actual seeking of medical care. Now, there may be a number of factors that operate in this situation. For instance, whether or not the individual feels that this condition requires medical care, whether or not he trusts the physician, and whether or not he feels that a standard medical care will actually reduce the symptoms he is experiencing. The third kind of delay is utilization delay or behavioral delay. This is the time period between the decision to take health care and the actual seeking of health care. The factors operating may be actually finding out a doctor, finding out what treatments or what hospital may be most effective, finding out how you will meet the expenses for the treatment, what kind of transportation facilities are available in case the doctor doesn't make home visits, and how can you actually arrange the seeking of medical help. Fourth kind of delay is medical delay. Medical delay is the delay that occurs after the person has made the decision to seek medical care, and the time gap between this decision and the actual provision of medical care to the person. For instance, if the doctor is very busy or out of town, it may take a lot of time for the medical care to actually reach the patient. Similarly, if there are a number of patients who are waiting for treatment, there may be a lot of time spent in the receipt of medical care. Total delay, this is the last stage, and this accounts for the entire delay right from the recognition of symptoms to the actual provision of medical care to the patient. And the delay during all these stages have an important impact upon both the individual's short-term and long-term survival and well-being. A delay in seeking treatment for certain minor disorders, for instance a running nose or a sore throat, can be understood and is justifiable. However, the fact exists that people tend to delay treatment even for potentially serious symptoms such as those comprising a heart attack and mitigate it to be comprising of some kind of lesser disorder, for instance gastric pains or muscle spasms. There can be a variety of reasons why individuals differ in their response to symptoms. One is the perceived expense of the treatment. This can be an important factor, especially for those who are from the lower socioeconomic strata. For instance, they may perceive many symptoms to be unimportant and may mitigate them because they believe that going to the hospital for every other symptom will cause a lot of expenditure which they cannot afford. A second factor is age. Researchers believe that older individuals are more likely to respond positively to illness, that is by seeking medical help, as compared to middle-aged and younger adults. One reason may be that older individuals have a lot of experience. They have seen the symptoms experienced by themselves throughout their lives as also by others, and hence they can understand the importance of responding to symptoms better. Another reason is that older patients may be more willing to accept that they are ill as compared to those who are young, because younger people tend to see themselves as hardy and sturdy and they don't want to be portrayed as sick. Another factor that can influence your response to illness is the lack of regular medical contact. People who go in for regular health checkups and have a regular medical contact with others tend to have a greater inclination to seek medical care immediately. On the other hand, people who rarely go to the hospitals or rarely visit physicians find such an experience very new and probably very stressing as well, and hence they tend to postpone medical care to a large degree. Another factor is fear and the lack of initiative. Most of us are afraid of the clinical settings of the hospital and the many procedures, medical complications and regimens that it involves. Hence, to a large extent, we want to avoid all this, and hence we tend to mitigate the symptoms as meaning nothing important. Also, we may lack the initiative to go to the hospital unless someone is behind us, either family, friends or relatives, and they prompt us and encourage us and remind us again and again that yes, you have some kind of symptoms, you better go and check it out with the doctor. We also have a fear of being wrong. When a person experiences certain symptoms, he feels that it is better that I experience it for some time and try to evaluate it on my own rather than rushing to the doctor, because I may appear silly or foolish if the symptoms turn out to be minor. This is more the case if he has to depend on friends or some others to take him to the hospital, to arrange for transportation and so on, or it is some odd time of the day such as working hours or the night, because after taking all this trouble, if the symptoms turn out to be minor, he has the fear that everyone will make fun of him and say that he is quite silly to overreact to even minor symptoms. Also, people may have a lack of concern for symptoms and a lack of concern for health and illness. They may be so preoccupied with the other activities of their life that they rarely think about changes in their bodily patterns and the changes in their bodily functioning. And hence, even major symptoms tend to be pushed off as something unimportant. They feel that the other factors of life are more important and need to be immediately dealt with, and health can be sidetracked. People who are staying alone, especially people who are new to a place and have very little social support, also find it difficult to seek health care because they may not know where a good hospital is or who may be a good doctor or how to reach there. A major factor in the delay in seeking health care are the errors in recognition and attribution. Many a times people tend to attribute symptoms to causes other than the actual physiological causes. For in case a person is experiencing chest pains, radiating chest pains and an increased heart rate, he may feel that either I am just anxious or probably they are gastric pains or muscle pains and may neglect them, when in actuality it may mean a heart attack. In fact, an interesting research was made by Julian in 1996. According to him, it is not only us lay individuals, but even doctors can make errors in recognizing symptoms. For instance, he studied 10 world-renowned cardiologists who themselves had taken up hundreds of cases of cardiac attacks and had diagnosed and treated these patients. But when they themselves experienced a cardiac attack, all these 10 cardiologists on an average delayed seeking treatment for nearly 48 hours because they could not correctly recognize the symptoms they were experiencing. The characteristics of the symptom in itself may be an important factor in promoting delay. For instance, if the symptom appears to be minor, for instance, the symptoms of a heart attack appear to be something minor, for instance, gastric pains, then an individual is more likely to postpone the treatment. Also, if the symptoms are something normal rather than something unique or atypical, then he is more likely to ignore the symptoms. It is because of this that many people ignore symptoms of melanoma and consider them as ordinary moles, which can be actually extremely life-threatening. Even after seeking medical treatment, delay may occur in two forms. The one is the treatment delay and the other is the provider delay. 25% of delay occurs in the form of treatment delay. Even after the first visit to the doctor, the patients may neglect taking up the right medications and the prescribed medical routines and regulations. They may even neglect going back to the doctor for a referral. This is because after the first visit, they feel that their curiosity regarding the symptom is satisfied and they know enough regarding what illness they suffer, and hence they can now deal it on their own. And another reason may be that they are so alarmed, panicked by the first visit that they no longer want to have anything to do with the hospital setting. Delay may also be in the form of provider delay. This happens when medical practitioners take a lot of time to diagnose the illness and engage in some kind of intervention and other medical procedures to control it. At times, they may even prescribe faulty medications, and they realize it only when the symptoms increase or the symptoms aren't decreasing any longer. Many a times, these are honest mistakes on the part of the physician, but the fact is that they contribute to a great extent to the delay in treatment. Also, symptoms are less likely to be diagnosed properly if they deviate from the profile of the person. For instance, a lump in the breast may be diagnosed as breast cancer and the doctor may recommend biopsy for a woman who is 45 years of age. However, if he sees the same symptom in a woman who is 25 years of age, he may diagnose it as fibrocystic disease and may not recommend a biopsy. However, this delay in diagnosis and further intervention can prove costly if the woman actually suffers from breast cancer. Also, sometimes the patient's symptoms may differ from what we actually attach with the disease. For instance, symptoms such as chest pain and breathlessness are naturally associated with a heart attack. However, radiating pain in the shoulders may also be a symptom of heart attack, but people will generally tend to see it arising out of some orthopedic causes, which can lead to a delay in medical treatment. Just as there can be a delay in seeking medical care, people may also tend to overuse medical care or use medical care more than what is required. Researchers have found that dangerous discrepancies or differences exist in the extent to which persons actually require medical care and the extent to which they are given medical care. A number of factors may contribute to this, and one of the major factors is the overuse of medical care. Overuse of medical care occurs when a medical treatment is taken without appropriate justification. Overuse may also involve taking medical treatment in higher volumes and costs, that is either taking treatment or giving treatment in higher volumes and costs than necessary or justifiable. Overuse may involve many facets. One is overdiagnosis, when the doctor diagnoses too many illnesses in the patient, even those which are minor and do not require any kind of medical attention. Second, prescribing unnecessary medical interventions even for minor disorders. For instance, disorders such as common cold or cough will go off in a few days. You don't need to take a lot of antibiotic medications for that, although doctors do prescribe it. Or undertaking too intensive treatments for disorders which are minor and do not require such intensive therapies and courses of treatment. Researchers have found that antibiotics are prescribed for 80% of ear infections in the United States, although both patients as well as medical practitioners know that ear infections normally go off in 3 days with or without medication. This facet of overutilization of medical care was brought into focus by the pioneering studies of Jack Wennberg in the 1970s and 1980s. He found that people differed in the amount of utilization of medical care depending upon where they lived rather than their own clinical condition. He also found that overuse may comprise every facet of medical care, right from diagnostic procedures and diagnosis to consultations and referrals to the prescription of medications, medical procedures and even surgeries, and even in the prescription of rehabilitation procedures. Thus, what we must remember is that in the field of healthcare, more is not always better. And whether the overuse is initiated by the practitioner or by the patient, it can be severely detrimental for the patient. There can be a number of factors that contribute to such an overuse of medical care. We'll go over some of these factors. The one is the fee-for-service model. The fee-for-service model simply indicates that the more services you give, the more fees you can collect. And this can be an important enticement for medical practitioners to prescribe a number of medical procedures and services, because the more the number of procedures and services they prescribe, the more are their monetary gains. A second field of overuse is imaging. Researchers have found that there is a drastic overuse of imaging procedures such as X-rays and CT scans in hospitals. And apart from forming an overuse of medical care, they also lead to overdiagnosis of minor physiological conditions which do not warrant any kind of important attention. In fact, the Canadian Association of Radiologists estimated that 30% of scans and imaging that went on in Canada were unnecessarily. Hence, respected organizations such as the American College of Radiology, the Royal College of Radiology and the World Health Organization now have set forth appropriateness standards or appropriateness criteria for determining whether or not imaging is necessary or unnecessary in a given situation. Another field of the overuse of medical care is physician self-referral. We often see that physicians refer patients for a number of medical procedures such as surgeries, imaging or other procedures, either which they are going to conduct themselves or which will be conducted in facilities they run or which will be conducted by fellow physicians from whom they get monetary reimbursements for referring patients. Hence, it is more likely and it is seen that physicians tend to refer a lot of patients to a number of procedures which are not really necessary, because the more procedures they recommend the patients to undergo, the more are their possible monetary gains both directly and indirectly. Another factor is the declining reimbursement for cognitive care. Now, what is cognitive physician care? Cognitive physician care involves the time the doctor spends with the patient, understanding his disease, understanding the various aspects of his ailment, understanding his fears and trying to find out what are the possible underlying causes so as to have an appropriate diagnosis. But in today's modern world, there are very little reimbursements or encouragement, either financial or emotional, for such kind of behavior. Even patients love physicians who actually prescribe some kind of procedure or some kind of medication immediately. Hence, patients also follow the fashion and engage in prescribing a number of procedures, whether or not they are necessary. Some other reasons for the overuse of medical care may be the use of defensive medicine, where physicians concentrate on reducing the possible negative effects because they are afraid that patients may sue them in case anything goes wrong. Also, patients generally have a number of insurance services, both public and private, which they can use and which removes this cost barrier from obtaining treatment. Also, many a times patients demand a lot of medications and a lot of procedures because they want to get really well and really soon. Also, they may lack a lot of awareness. They may take information from a lot of unreliable sources such as friends and family rather than standard medical care professionals. Hence, they tend to use medications that are newly available in the market and which pharmaceutical companies promote without understanding whether or not these treatments are really good for them. Also, patients generally tend to have this wrong and erroneous belief that newer medicines, costlier medicines and larger doses of the medicine are always good for them, which is a single major factor promoting overuse. Now, as we conclude this chapter, let us understand that there are no single interventions for controlling the overuse of medical care. In fact, it requires a concerted effort between all stakeholders. For instance, the government policymakers, the pharmaceutical companies, the doctors, the physicians, other healthcare professionals, and most importantly, we the patients. For instance, government bodies should set up proper regulatory mechanisms to ensure that proper information regarding treatments reaches both the doctors and the patients. Also, physicians should go beyond these standard prescribed models of healthcare, and rather than dumping a lot of services and medical treatments on the patient, should take time out to understand what the individual's particular illness is and thus seek a proper diagnosis and intervention of the ailment. Finally, there is something important which you and I as patients must remember. Let us be more skeptical about the healthcare procedures. Let us ask questions and ensure that the treatment we get is something we deserve and is something we actually need. And let us also remember that in the healthcare field, more of medications or newer medications or costlier medications are always not the right thing for us.